The honourable member for Bowman has the call.
Thank you. Thank you, Deputy Speaker. Mr Speaker, I support this motion as well because this is clearly an attack on PHI.
Is the seconder, the honourable member for Bowman, speaking now, or is he reserving his right?
I can speak. I can speak now. I can speak now, Mr Speaker. That's what I was.
The honourable member for Bowman has the call.
Mr Speaker, this is a direct attack on Australia. It's not just an attack on those who have PHI, but this is an attack on the dual health system that Australia is so proud of. Mr Speaker, what we've seen is a Labor government who perennially hate people that have private health and only now are having their third attempt to try and make it even tougher to keep private health insurance. Now, Mr Speaker, it's quite simple that if you are a family that has PHI at the moment, the average person that has PHI in this country earns around $47,000. They are within $100 or so, with only just a few $100s of Australians who don't hold private health insurance. And that comes from an ATO 1% sample that we've been able to analyse. The difference is about $12 a week net income difference between those who hold insurance and those who don't. And remembering that those who have insurance actually pay out of their own pockets $1,300 for their private health insurance, Mr Speaker, never forget that these people make themselves poorer in order to pay into the future for the hospitals we need today, for the older Australians who may be joining private health late in life and need to know that there are services available. And never fool ourselves on this side of the House that any money that's ripped out of the private health system, or any money indeed that's clawed out of this rebate, will ever trickle its way back to public hospitals run by the state governments. And there's no better example of that than the stimulus package of 2008 and 9. And I would ask this chamber to remember how much of that money was spent on healthcare when it really mattered. When we had a Prime Minister promising us the buck stopped with him, how much of the stimulus money, when it was available, was directed into health infrastructure at all? Not a cent. No, not a cent of that money went into health infrastructure. So why should Australia believe today that any of these desperate savings will ever find themselves trickling back into public hospitals? Look, Mr Speaker, it is quite clear that the second great proposition put by this government is that millionaires don't need their PHI paid for by the rest of Australia. But as was articulately just put, Australians at all levels pay for the Medicare rebates of people of all incomes, pays for the PBS services of all Australians, pays for the childcare rebates of all Australians, pays for all Australians, rich and poor, to go to a public school in this country. And we don't charge high-income earners more money to send their children to university. No, we are a nation proud of our universal health and education system. We're a nation that's proud that we don't attack people because of their income for the access to social services. If one truly, truly hates high-income earners, Mr Speaker, then attack them through the tax system. I mean, that's the way to beat down high-income earners. Take them on in the tax system, if one is so courageous to do so. But no, we can't do that. What we're instead going to do is attack them through access to the two great pillars that we're so proud of in our social services, health and education. We were once a proud nation that made health services available to everyone, but we are no longer with this legislation. Now, everyone can quote studies from all sorts of different sources about who will pull out and who will downgrade. But we know one thing: with the elasticity of demand, you make something more expensive for people, they are more likely to pull out. And we know when cost of living is as high as it is today, that effect will be acute. Now, I don't care which study is quoted, whether it's Deloitte or Booz & Co or any other provider of this information. I can tell you one thing: this is a government that downgrades. And the Australian people are someone who aspire to be able to upgrade, to be able to save hard and pay for the future and pay for health care. And this is a government making it harder and harder to do so. Now, Mr Speaker, the figures are that around 1.5 million Australians are directly affected by these changes. Now, what do you think a rational actor will do? We will sit around the kitchen table with skyrocketing cost of living and say, you know what, we can just downgrade a little bit. We can actually get ourselves the 10% savings to make up for the 10% increase in our rebate. I mean, that's utterly rational. So let me take it to the next extension here. What do these families in remote and rural Australia, for which the value proposition for private health is probably lowest because there's the fewest private providers out there, what will those regional families be saying? Let's drop 10% of our cover, let's make an exclusion and save ourselves the 10% that Julie Gillard is laying on to our cost of living. And, Mr Speaker,
the Prime Minister, I think the member for Bowman is referring to.
Mr Speaker, I'm talking about the entire Labor government, so I don't want to name every single member.
Julia Gillard, he is aware that is disorderly. He should refer to
Mr
her
Speaker,
by her position.
she is just as guilty as her entire government. So the entire government is responsible for that. Deputy Speaker.
Order. The member for Bowman is stretching the tolerance of the chair.
Prime Minister. Deputy Speaker.
The member will also withdraw the imputation on the Prime Minister. I
withdraw the imputation on the Prime Minister, Mr Speaker.
The honourable member for Bowman continues to have the call.
Thank you. So what we have is the value proposition of private health, most tenuous in regional Australia, where there are the fewest private providers. And then suddenly, of course, we don't have private doctors, we don't have social workers, we don't have physiotherapists, we don't have private psychologists. So then, of course, we undermine general practice in regional Australia. I mean, Mr Speaker, 8 million Australians live out there, and I know it's often forgotten by this government, but 8 million people rely on the private system to draw our health practitioners out to regional Australia. And what happens when they pull back, Mr Speaker? Well, the first thing that happens, of course, is they're not there to do the public outpatients. They're not there to be the VMOs. They're not there to do the after hours on call. And we get appalling situations like Gladstone, where this member will know, goes on complete bypass for surgical cover for weeks on end in the absence of a surgeon in a fine city like Gladstone. So the people of Gladstone, as a result of decisions like this, will be faced with appalling transfers, expensive locum surgeons, no one staying in the bush and providing continuity of care because the actual private delivery of services that support public hospitals is undermined. Now, Mr Speaker, I don't need to explain how the private health system works to you or to anyone else on this side of the chamber. But for those on the other side who always forget, never, ever, never omit, never airbrush away the fact that it is the private providers who are called in to fix public hospital waiting lists when they blow out. And when a private patient steps into a public hospital, it is that health service that bills the private health insurer for profit. This is an integrally entwined dual health system. You cannot poke one side of it without there being a completely counterintuitive reaction on the other side of that health system. Now, it's exquisitely balanced. It's been so for 15 years. And it was the health minister before this one and before the one before it that brought in those three pillars of lifetime health cover and community rating. And this 30% health rebate that has got us to a system where 1 in 2 Australians, not the rich, not the poor, but 1 in 2 Australians can affordably contemplate to put in $4 a week out of their pocket, out of the $80 a week we spend on every Australian's health care, okay, can actually take a $4 discount, my correction, the 30% rebate, put in $11 of their own money each week and pay for their own cover and take the burden off the public system. That's right, it's a very good investment, Mr Speaker. I mean, never forget the idea of the contributions being made as a result of that 30% rebate. For every $4 discount that this federal government gives through a 30% rebate, $11 of one's own money is poured into the system. That builds the infrastructure that without it, it would not exist. Now, we don't have to go back very far to recall what it was like 2 decades ago under the last Labor mob when private health insurance fell to 34% and could not be rescued through the wit of the other side. They failed to understand the value of private cover and private health. Now, the productivity report last year, Mr Speaker, made it very clear that the cost per separation, that the cost per service in private hospitals, in independent providers, is very competitive and, to be honest, usually cheaper than getting it done publicly. So I put the proposition to you, Deputy Speaker, who lives in an aspirational part of Australia, Mr Speaker, with a large number of people who are privately covered. What is the implication of people downgrading their care and taking exclusions? Taking exclusions for surgery, assuming you'll never get cancer, electing not to have allied health cover on your policy. Well, I tell you what they do. They turn up later at a public facility and they add themselves onto a longer and longer waiting list. And we know one thing, Mr Speaker, that services delivered through the public system are slower and more expensive. Eventually we pay the tab for this $700 million that they're trying to claw out of the health system today. We will never forget that the money clawed out in this motion today is paid for in an exquisitely clever cost ship to the state systems, where they have to fund the locums to replace the doctors who leave, public allied health service to replace the private ones that leave, and ultimately, as people add themselves to waiting lists, we have waiting lists for waiting lists, don't we? Where people never get a service because they either pass away or go private. I mean, that's the only two ways off a public waiting list in a situation when they're not being delivered. So, Mr Speaker, this is a very serious matter. It's a matter of life and death, and everyone here feels strongly about it. On the other side, in contrast, we have a government that is blinded by the potential for savings. Not because they're impassioned about investing it into the state hospital system. Oh, no, that money has never made it there. Mr Speaker, this money is about getting a surplus at the next budget. That is about saving their economic reputation, and they're using health measures as a treasury strategy to find their savings and try and get back into surplus. Now, that's what it's all about. If there was any passion for health on this other side of the chamber, Mr Speaker, you would see it. You would see it in their investment in the stimulus package. But alas, they proved when the money was there, they never spent it. When they got the health fund off the Howard government that had millions of dollars in it, taken from bona fide surpluses, it was simply shifted across into a completely different purpose, but never invested wisely, and never continued. And at the end of this year, you know where that health fund will sit, its balance? Zero. Okay? That money will be gone, will have disappeared, with no plan for the future. It's a government with no plan for the future and no plan for those that are privately insured. So, in conclusion, Mr Speaker, we have an exquisite dual system of public and private provision. We have doctors and allied health workers and nursing staff who work in both sectors. It's the health providers who work for Australians regardless of which service they choose. Mr Speaker, privately insured people use the public system. When waiting lists get too long, public patients use the private system. The two are equal, they are balanced. They are at the moment serving 1 in 2 Australians. It's a model that should not be interfered with, tampered with or molested. It should be left as it is. The 30% rebate works exquisitely well, and Australians at all incomes, and we've talked about the proportion that earn less than $35,000 a year, people of all incomes can rationally choose between taking private cover or sending their children to an independent school. But it is that choice that this government has always been opposed to. I've said, Mr Speaker, they are committed to downgrading the Australian people at just the time when Australians aspire to upgrade, to have options, to have choices that are being taken away by the Gillard Labor government.